Thank you, Mr. Speaker. Right from the onset, I want to say, Mr. Speaker, that I support this budget. However, Mr. Speaker, I must dissuade some of the members of this August House from deciding that because I come from Mount Kenya now, I am guilty of what my forefathers did. We had at independence, when the session paper number 10 was made, we had representation in the cabinet from across the country. If the people at that time in government, and it was a government that was formed across regions and across the ethnic divide after having fought for independence, the wisdom of our forefathers cannot be used to make us guilty today. Mr. Speaker, this budget has a lot of money going to the blue economy. I am not complaining. I am encouraging people in my region to also venture into aquaculture and benefit. That is the kind of mindset I would like to see that our current leaders articulate and adopt, so that today we are building a better foundation for our children and their children to be able to resolve the challenges they will face. Can we resolve the challenges we are facing today without wanting to demonize one section of the country or one area of the country? I voted in this parliament to remove a person from my region from office because I felt he was not right for this country. Do not, I urge us to really embrace the broad-based government. Look, adopt what Honorable Atadi has done as the chair of budget. Let us use that focus. Honorable Speaker, I am happy that coffee has gotten money for revival, 500 million. The revival of coffee in this country and the earnings from that crop, from that cash crop, will be more dependent on the new coffee growing areas which go into Nyanza, that go into the Rift Valley, that go into Western Kenya. But at the same time, some of that money must be plowed into the Mount Kenya region for regeneration of the old coffee bushes, which are 62 years old plus. Honorable Speaker, I am happy that we have money to revitalize new KPCU that will serve the whole country in terms of warehousing, irrespective of where the coffee is coming from. I am happy we have money for settling coffee debts. Mr. Speaker, our athletes have really made our country proud. Of late, we have suffered the shame of some of our athletes being caught in doping. The fact that this budget has provided money for testing and for educating our athletes is a big plus. Mr. Speaker, the TVET sector is the game changer in this country. At a time when formal employment is shrinking, at a time when digitization is changing work as we knew it, the acquisition of technical skills and is really one of the areas that is going to help our people go into self-employment. The fact that we have provided additional resources for hiring technical staff is a big plus. Mr. Speaker, I am an alumni of the Kenya Medical Training College. Higher education funding in this country has discriminated diploma students for a very long time in this country. Students pursuing medical courses have not been benefiting from help. Students pursuing diploma courses in education, yet the teacher training colleges fall under the Ministry of Education, have not been benefiting from help. It is important that, it is instructive that in this budget, part of the health budget has had to be appropriated to provide help for KMTC students. I am urging this House to collectively look at the issue of funding tertiary education so that none of our young people are discriminated. Mr. Speaker, our referral services in our national referral hospitals.
Come and take over.
We have really been complaining about the level of services, but one of the biggest burdens in those institutions has been the shortfall in personnel emoluments. And I want to thank the Budget Committee for accepting the proposal by the Health Committee, where I'm a member, to fully provide for the personnel emoluments package for all our referral hospitals. Mr. Speaker, UHC is heavily dependent on the provision of diagnostic services at the lower level facilities, level 2, level 3, and level 4. Mr. Speaker, the expired MES program has stood in the way for the implementation of the National Equipment Placement Service that is supposed to benefit UHC health facilities. And therefore, I am happy that money has been provided for the closure of the MES program and pave the way for NESP. Mr. Speaker, one of the saddest things is when we have to be told that our children cannot be immunized on account of our failure to limit funds for vaccines that are provided through Gavi and UNICEF. Once again, Chairman Atadi, I want to thank you for caring for the children of this country and ensuring that the liquid counterfeit funding for our vaccines and also for the HIV and TB commodities has been provided. Again, the shortfall of almost 34 billion from the withdrawal or the threatened withdrawal of USAID funding in the health sector. Again, the fact that this has been provided in this budget is a big plus. Mr. Speaker, I have seen quite a number of sports academies. I want to remind our House, this House, that the CBC pathways dictate that talented athletes across the country should have facilities for the development of their talent. And therefore, Mr. Speaker, I am urging us all to be much more aware while looking at the proposal on where the sports academies are going to be built to ensure that there is equity across the regions and across the counties because sporting talent abounds. Mr. Speaker, I am unhappy also in this budget about the reduction in the provision for payment for children, orphans, and vulnerable families for supporting them, the indigents, with the national health insurance. Mr. Speaker, these are the lowest of the lowest in our society. It is not possible for us to remove money that is supposed to pay for social health insurance fund for the street families in this country. Where is our conscience? It is not possible, Mr. Speaker, for us to remove funds that is supposed to pay for social health insurance funds for orphans in this country. Where do we want them to access health services from? Yet it is mandatory for every Kenyan to have a social health insurance card. Therefore, again, when we come to that area, I urge this House that we be more careful in terms of dealing with the most vulnerable in our society. Mr. Speaker, in ending, the education sector and junior secondary schools. These schools are supposed to have science laboratories. I'm urging the Education Committee and this House in the consideration of the education budget to kindly factor in money for the construction of JSS laboratories.